Okay, we are continuing our anatomy of the upper limb, working our way up to the proximal humerus and shoulder joint. We're going to look at the scapula and the clavicle and the proximal humerus. All right, so this is the humerus in anatomical, the whole upper limb in anatomical position, palm side facing us. I'm just going to drag it down a little bit and so that we can focus here on the more proximal part of the humerus, and then we'll kind of start flipping it around to look at the scapula. All right, so very, very important structures on the proximal humerus that we will have to be able to identify on many of our x-rays to decide the rotation of the arm, whether we rotated the arm laterally, meaning the thumb pointing away from the body, or rotating the arm medially, bringing the thumb in towards the body, because we have these tubercles here. There's the greater tubercle and the lesser tubercle. So first and foremost, we need to know greater tubercle is more lateral, the lesser tubercle is more medial, closer to the midline of the body. All right. Anything closer to the scapula, right? It's towards the midline of the body. Our spine would be here. This would be the center of the body where my pointer is jumping up and down. Okay. Then working our way out laterally. So greater tubercle is more lateral than the lesser tubercle. Now there's this groove that sits in between the greater tubercle and the lesser tubercle of the humerus. It's called the intertubercular groove, or also known as the bicipital groove, because the bicep muscle inserts there. While we're talking about that, we can look at the deltoid tuberosity here, where the deltoid muscle inserts. All right, so we'll be able to see that in our x-rays too, but really not identifying the position of the arm by the deltoid tuberosity. We're going to be really focused here on the greater and lesser tubercles and the intertubercular groove, also known as the bicipital groove, which is easier for me to say, so I like to say bicipital groove. All right, and then this little green line here, they're showing us the surgical neck on the humerus, and this purple line up here going across the humeral head is called the anatomical neck of the humerus. All right, so these are very important pieces of anatomy that you need to be able to identify and know, because when we start to turn our arm medially or internally, I'm gonna play around with this. I'm gonna turn the arm in medially as if we're turning the arm in. You see what happens with these tubercles? That means on our x-rays, those tubercles are gonna be placed in a different position in relation to the humeral head, depending on the rotation of the arm. So just now I rotated the arm in, kind of bringing the thumb in towards the body, internal or medial rotation. In internal or medial rotation, you notice that greater tubercle will start to turn medially as well, right? This being the greater tubercle, this being the lesser tubercle, this being the bicipital groove. So you can see how in our x-rays, depending on the position that we place the arm in, those structures are going to look different, and we're going to describe those structures differently depending on what x-ray we're looking at. We need to be able to find the greater tubercle in an x-ray and decide that if the greater tubercle is in profile laterally, then that means the arm was rotated out laterally, that the thumb is pointing away from the body. If we look at an x-ray and the greater tubercle is superimposed over the humeral head and the lesser tubercle is also superimposed over the humeral head, then they're in a more neutral type of position, where the arm in neutral position is where the palmar side of the hand is against the thigh. The arm itself is in just a neutral position. Now, if I continue to rotate the arm even more medially, now what's in profile? The lesser tubercle is sticking out in profile medially towards the body. All right, so we have external rotation, greater tubercle, and profile laterally. Internal rotation, lesser tubercle in profile medially. Neutral rotation, greater and the lesser and greater tubercle superimposed over the humeral head. So important to understand that and know that, because we're going to talk about that in our humerus x-rays and our shoulder x-rays. We'll be determining the rotation of the arm by those tubercles and where they are sitting in relation to the humeral head on our x-rays. All right. Okay, so let's look at the scapula. Let's look at our scapula anatomy. All right, so we have the subscapular fossa. This is the anterior side of the scapula. So I want you to put into perspective here, the coracoid process projects anteriorly. The coracoid process projects anteriorly. The coracoid, right? The acromion is more posterior. So coracoid is more anterior, acromion is more posterior. The subscapular fossa is the anterior side of the scapula that sits against the ribs, right? Sits against the body. So we have our borders, right? We have a superior border, we have an inferior angle, we have a lateral border that's closer to the humerus. So this is also called the axillary border, lateral or axillary border. The medial border is also called the vertebral border. I like to refer to it as the vertebral border because it helps me to remember that it's more medial towards the vertebra, towards the middle of the body. So the medial or vertebral border. We have a superior angle, the inferior angle, right? Superior border here. All right, now let's turn this around so that actually, let's look at the glenoid here. The glenoid fossa is important. We're going to do a special x-ray called the Grashy method that is to we turn the patient into a 45-degree angle to place that glenoid fossa in profile so that we can see the separation of the humeral head from the glenoid fossa, that joint. It's called the scapulohumeral joint or the glenohumeral joint. So that's a very important structure to understand the way it's shaped. It has kind of like an oval shape, and we'll actually be able to see that little oval shape in our AP shoulder x-rays, also our humerus x-rays. So anyway, so this is the glenoid fossa, very important structure to understand. We have the supraglenoid tubercle. We really don't, we don't spend a whole lot of time trying to find that little guy and labeling him on the x-rays as radiologic technologists, but we do spend a lot of time identifying the glenoid fossa and its relationship between the humeral head on our shoulder x-rays and humerus x-rays. Once again, coracoid anterior, the acromion posterior. So let's turn it around and look at the posterior part of the scapula. All right, so this is important. If you're looking at a bone, because I'm going to have you identifying left scapula or right scapula, left humerus or right humerus. So you need to know what structures are more lateral, what structures are more medial, what structures are more posterior, what structures are more anterior, especially the anterior posterior, referring to the scapula, because if you're looking at the scapular spine here, then that means you're looking at the back of the scapula. So you have to kind of turn yourself around and decide, is this the left or is this the right scapula? So here's the scapular spine, right? Here's the acromion. So you see how you can see you can follow the scapular spine to the acromion if you're looking at the posterior side of the scapula. Of course, in x-rays, we're going to see everything from front to back, all superimposed over each other. So this can kind of put into perspective how that coracoid will be superimposed over these structures, right? So the coracoid, will be seeing the coracoid, but it's superimposed with these structures on our images, on our x-ray images. All right, this area right in here is called the supraspinous fossa or the supraspinatus fossa. We are going to learn a special image that we do in for the scapula or the shoulder. Actually, I think it's considered a shoulder X-ray, where they're looking at the supraspinatus fossa. So we're going to be turning the patient into an oblique to turn the scapula like this so that it's on end. And then we're going to angle the tube, put a little angle on the tube to go down through that subscapular fossa. And they'll be looking at the relationship between the acromion here and then the coracoid here, right? There's an arch right here that they'll be assessing for that supraspinatus fossa image. All right, so let's see. Oh, the neck, right? Here's the scapular neck, right? So the scapular neck projects from the glenoid, right? So we got the glenoid cavity or glenoid fossa is the place where the humeral head articulates with the scapula, right? Fossa. What else? What else? Let's see. I'm trying to think. Oh, there's probably a million other things that'll come up. But so just putting into perspective anterior to posterior structures, medial to lateral structures. All right, so let's look at the clavicle real quick. We've got the sternal end of the clavicle where it articulates with the sternum. This is the facet here, the sternal facet. Then we have the shaft of the clavicle and then the acromial end or acromial extremity of the clavicle. The clavicle is not all that all that crazy, right? It's not too bad. And we'll be learning images of the clavicle where we'll be doing a perpendicular central ray to see it straight on, and then we'll actually do one with an angle, a cephalad angle, to try to see the scapula in a different view, like from the bottom, from the inferior part up. Let's see, what do they have highlighted here? What's this? What's this? Costal tuberosity. All right, the costal tuberosity. What do they have here? Subclavian groove, conoid tubercle, right? So these are all different things on the clavicle that the conoid tubercle, I would say we'll be able to identify that on our x-rays and look for that. So I think on our clavicle, what we'll want to focus on is knowing the sternal end and the acromial end, which is easy, right? And the shaft. And then we'll keep a lookout for that for that little conoid tubercle on our images. Other than that, the clavicle's not all that in depth, when it comes to that. All right. Okay, so I hope that this was helpful, and thanks for watching.